Hi, I'm Dr. Mukesh Gupta from Lenest, Malad. Nausea, morning sickness, vomiting. These are one of the most earliest striking symptoms during the pregnancy. In fact, they actually tell you that yes, pregnancy has started. But the good news is that the moment they come in, you feel nice about it, that you're getting pregnant. But the bad news is that sometimes it may really take away the basic happiness and the excitement of the pregnancy. So let me today discuss about why does it happen, how often does it happen, what are the causes that are troublesome which can lead to complications in the mother because of which this can happen. Is there any issue that it can affect the baby? And last but not the least is what are the common tips that can be followed to reduce it. Okay, so let's start with what exactly is happening when your body is getting pregnant. There is a lot of hormones which are changing in the body, like for example HCG hormone, which is increased in a very large amount. The hormones estrogen, progesterone is also increasing in the body. Now almost 70% of women during the early pregnancy, in the first 3 months of pregnancy to be very precise, commonly face this problem, and this problem actually affects them to some extent or the other, even later part in around 10-15% of the patients. Now when we're looking at what are the causes for this, the first thing that strikes you is the HCG hormone. The HCG hormone actually said that it may stimulate and trigger the vomiting center in the brain, and that leads to excessive vomiting. Besides that, also the estrogen and the progesterone, which is increasing the body, can create a sense of queasiness or discomfort in your GI system. Add to that the delayed gastric emptying time and the relaxed sphincter between the esophagus and the stomach. It leads to regurg and discomfort, which again leads to that feeling of burning in the chest and also acidity, and then of course nausea and vomiting. Fatigue, tiredness is another big problem. So that is one thing which can lead to more of discomfort, leading to nausea. Stress in itself can cause vomiting and nausea. Sometimes some diseases in the mother can also be adding to it. It can be a disease or it can be a natural process. For example, multiple gestation, higher chances of vomiting. It's very simple because there's more HCG being produced because there are multiple gestation, and that leads to more vomiting. Another thing that is there is some diseases which can lead to that problem. For example, hereditary form mole, etc., which is an abnormal type of pregnancy. So all those things can lead to excessive nausea and vomiting. Does it affect the baby? Well, to be frank with you, vomiting in itself is not going to affect the baby. In fact, increased vomiting in the early part of pregnancy is a sign that your HCG levels are good and your fetus is growing well. But if there is an excessive vomiting and you're not eating your food and it is affecting your appetite, then definitely the baby can be affected. So you need to actually take care about your diet. So what are the common things that you can do to bring down the incidence of nausea and vomiting? So I'm going to quickly run through some top tips. Number one, don't stay hungry for long. Eat every few hours. That is one good sign. Number two, eat healthy diet before you sleep and hit the bed. Don't sleep with very light meals, because that can also be a little bit of an effect of that. At the same time, it should not be very spicy or oily, which can affect you. So cut down on your fat and cut down on your oil and ghee and cheese at that time. Remember, liquids, easy to go in, easy to come out. So don't have a lot of liquids if you're feeling nausea, because it's going to come out also easily. Instead, choose dry biscuits, crackers, or similar such things, toasts or such things, which will help to stay back. Have simple food with not excessive dash of cheese or ghee or oil, because that in itself can lead to excessive nausea feeling. Sometimes the very smell which used to attract you from your partners, the cologne and etc., actually starts affecting you and it starts irritating you more. And your husband says, "Come on, darling, you used to love this cologne. What's wrong with you?" Well, that is exactly what happens during pregnancy, because your perception of the smell and perception of the things around you changes drastically. So mellow down the smell and all those things which are actually the smell which are affecting you. Try to avoid them. Don't use those perfumes which are causing more trouble of it. I'm not saying avoid your husbands. Another thing that we have to understand is that sometimes uncomfortable situations, lack of sleep, tired, fatiguedness, all these things can add to that. So don't stress yourself more during pregnancy. Calm down, stay calm, and that will help you to bring down your nausea vomiting in a very big way. Another thing that can help you is yoga or meditation or similar such things, which also helps you to overcome the stress in a very big way and also helps you to breathe. try to look for place for fresh air. If you feel claustrophobic in a closed environment, move out, go out. You can, try to maintain the temperature of the room the way you are comfortable, because remember, during pregnancy, sometimes you feel very cold, sometimes you feel very hot. So the tip here is you can wear layered clothing, which will help you to, accommodate with that kind of variabilities. Lastly, most important part about vomiting is that if you do not eat well, then it is going to affect you. So remember, let vomiting do its job. You do your job, and that's eating good food. If you're not eating well, there is a condition called as hyperemesis gravidarum. Now, what is that? If you have excessive vomiting, it leads to reduced appetite. The reduced appetite leads to not eating and starvation. Starvation leads to a metabolism in the body, which leads to release of ketone bodies, and that ketone bodies in turn increases the vomiting. More vomiting, less eating, more starvation, more ketone, more vomiting, and it keeps on going into a vicious cycle. And that's the situation when women sometimes land up getting admitted in the hospital and taking injectables, drugs and medicines and all those things. To avoid that, remember one thing: whenever you feel nauseous or vomiting, don't think that is something to stop you from eating. So you do your job, eat good food, try to motivate yourself to eat good food. Sometimes of medications or household remedies can also help you, like ginger or lemonade or lemon peels or whatever, all those things which really help you. Sometimes some mouth fresheners help you. Sucking on some toffees or mints, sometimes some people are used to, and they are very happy with that, and it helps them overcome the vomiting. Sometimes some wristbands or pressure points at the wrist, which is said to be useful in many of the patients. They say that they claim that it helps them. Well, so be it. If it helps you, you should also try that. And all these small tips can actually help you. And if it still doesn't work, go to your doctor. He will help you, giving you some medications which will help you overcome the vomiting. There are so many medications which are now available, which are reasonably safe and used for prevention of vomiting and nausea during pregnancy. Use the help, right? Remember, last but not the least, it is the lack of eating that causes complications and not the nausea. Thank you very much.